Good afternoon, everyone.
Okay.
My name is Donald Burke. I'm the Dean of the Graduate School of Public Health here at the University of Pittsburgh and the Associate Vice Chancellor for Global Health. The program for today is entitled Haiti's Road to Recovery. The objective of this is to look at ourselves as a university community and say, going forward, that we are now past the crisis phase and we're entering into phases of recovery and restoration. Universities are not rapid deployment forces. We are not groups that can, on a moment's notice, drop what we're doing and go places. A few people can do that, but for the most part, universities are not structured that way. But universities are structured in ways to provide help over the long term, to provide training, to provide research for problem solving, to help organize thinking both here and in other locations. And we're also structured to think about the future. And that is, if something else happens in the future, what should we be doing, not just in Haiti? So the purpose of today is saying, going forward, how should we as a university community be most helpful in situations of crisis, focusing, of course, on Haiti and over the immediate future in the next couple of years, but also the longer term. How can we do that? So we have compiled a panel of 8 outstanding speakers, all of whom have expertise on different dimensions of the problem. The first will be Paulo Teixeira from the Pan American Health Organization, who has very first-hand knowledge of Haiti and can describe the situation there very thoroughly. And then we will go down, so he'll speak for about 15 minutes or so. And then the other speakers, each going down in this order, will take about 5 minutes each to give their unique perspective from the Pittsburgh academic and philanthropic and action community. So with that, I'll turn it over to the speakers. After the presentations are done, then we'll have a general discussion, which I hope will be targeted around what can we as a community do more effectively? How can we pull ourselves together now and in the future? Okay. With that, Dr. Teixeira, you're on.
Okay, good afternoon. First, I'd like to thank on behalf of Dr. Mita Rosas, who is the director of the Pan American Health Organization, for the invitation, and congratulate the Center for Global Health for this so important initiative. I will be sending showing some images from the recent visit of Dr. Rosas to Haiti last week. So it's very updated images, and I will make some comments on what's going on in Haiti and how the international community can help the country itself. As you know, Haiti is the poorest country in this hemisphere, and the situation in Haiti was becoming better this year after 6 years of the mission of the United Nations mission in Haiti for stabilization political crisis that started in 2004. Sorry. And then this earthquake comes, and the country is the most part of the country, which is most populated part of the country, is completely destroyed. Haiti has 59 hospitals and 68 health services, and most of them are destroyed. In Port-au-Prince, we have 11 hospitals. 8 hospitals working well, and 3 hospitals not so good. The problem we have facing now in Haiti is the The country is destroyed. There is no ministries, no buildings, nothing. Even our staff, they don't have where to sleep. And then the international organizations come. We have 650 international organizations work in Haiti, 60 on health sector. And this is completely discoordinated. So what PAHO is doing there is trying to put together and coordinate all the health actions for Haiti. So we have a cluster we call cluster of health, and then this cluster is trying to organize the actions in terms of vaccination, immunization, rebuild the infrastructure of hospitals and everything. It's not easy, but now even those international support cannot be welcome now, because we have to reestablish the minimum capacity to receive the international volunteers or international equipments, everything, no? And we are trying to do this. So the strategy that we are working now is trying to finish the first phase, which is responding to emergency, and now we'll be starting next month the reconstruction, or to reestablish the infrastructure of the country. You know, in this way, I've been talking with many people on how we can collaborate, how we can support Haiti. You know, and PAHO is receiving the great amount of offers in terms of volunteers, equipments, supplies, everything. One idea that is being adopting is that some organization, university, or NGOs can adopt a neighborhood or a hospital or a center and then try to reestablish their capacity of working. Many people now start talking about a Marshall Plan for Haiti, you know, which has been done in Europe after the World War II, something that can reconstruct the country. And I wonder myself if you can help them also rethinking the development model of Haiti, because it's not just to reconstruct buildings or put together institutions working again, but how we are going to face the poverty and the other issues that are so important and have to be solved in order to promote health and quality of life for those people. I don't know if you know, but we have in Haiti every single day 700 births. So a lot of people has died, and the numbers. Haiti faces a very difficult situation in terms of data collection and information. It was not new. It was in the past, and now it's worse because the institutions, each institution has different numbers. But people say that more than 100,000 people has been died. But many people the mothers are giving birth, 700 daily. And those babies, they don't have the minimum in how to survive, you know. So this is also an important thing for us, is this not just thinking on the people that have been injured or died, but also those that are born today and tomorrow, no? So for PAHO, all the initiatives will be very, very important. We are receiving all the support and trying to canalize very well in terms of our possibilities. But what can I say is this: in this moment, it's quite very difficult to send volunteers for Haiti, for instance. Everything is, the ministers are working in the floor, there is no room, the Minister of Health has been completely destroyed, the parliament, the justice, all the institutionality in the country is not working. And a lot of displacement. As you know, the infrastructure of the city, Port-au-Prince, has been collapsed, and most of people has been to the interior part of the country looking for families or for some people, some other support. So, and this displacement also has impact, health impact also. And that has to be very well analyzed and faced. So I will leave my colleagues to the word, and then I understand that after we have some questions and I'll be able to answer. Thank you very much.
I think that for purposes of time, I'll just let the speakers take over at their allotted turn. So
Okay.
go ahead and introduce yourselves.
All right. Are we going to put the lights back up? Or?
Yeah, why don't we do that? Can we get the lights back up, please?
Okay, I'm Kent Harries. I'm a associate professor of structural engineering and mechanics here at Pitt, and I'm going to change the focus just a little bit for 5 minutes, and then we can go back to the good stuff. Inject a little bit of the technical here, and really what I want to do is explain a little bit to you what you've been seeing on CNN or all those other good places, maybe not Fox, but all those other good places over the past couple weeks, and put some numbers to them and maybe a little bit of understanding as to why one might argue that this particular event, to a great extent, was really the perfect storm from a technical perspective. Just to put some numbers to this, 4 days ago, the New York Times is reporting, and now I'm going to talk the Times of Things, a little bit of stats, are reporting numbers like 20,000 commercial structures destroyed, an order of magnitude greater, about almost 250,000 residential structures destroyed or collapsed. The death toll, I know, is varying right now, regardless of what number you want to put a handle on. Absolutely an order of magnitude greater when we talk about injuries and displaced people, probably in this case more than an order of magnitude, more in the lines of about 20-fold, I would guess. So what happened? Haiti is a poor country. Its construction methods are very typical of many, many countries around the world. We colloquially define the construction, pretty much everything that you've seen that's collapsed in pieces, where we used to have a 4-story building or a 3-story building, and now it's a 3-story pile that's about 6 feet tall, is what we call confined masonry. The problem is that these types of systems don't work if they're not designed properly. They don't work if they don't have seismic detailing, as an example, if we don't design for seismic. Now that should be self-evident, that we should be designing for seismic in a seismic zone, but we don't have a building code in Haiti. None. There's nothing that's adopted. From my discussion with some of my colleagues, there's no licensure requirements for engineers, for architects, for planners, for contractors, and whatnot. And although apparently there is a permitting system, it's largely ignored. So we have these issues. The codes that do tend to be adopted in Haiti, which the French Building Code and, in fact, the U.S. Concrete Code as well, are both adopted without any seismic provisions. And so we have, what little direction we have is not addressing the big problem of the seismicity of the region. Why is the seismicity an issue? One thing that a lot of people, and I'm not certain if this is going to come out and be discussed today, is that there's really no memory. If we look for comparable events in Haiti, the last one was 240 years ago. There's no societal memory of this. We tend to forget these things. The event itself was not, I have 1 minute, the event itself was not a terribly large event, a couple of these a year. It was comparable to Northridge, comparable to Loma Prieta, to Kobe, little bit smaller than the Szechuan, or quite a bit smaller than the Szechuan earthquake last year, 2 years ago. The problem was it was a shallow event. It was very close to Port-au-Prince. It was only 25 kilometers. The epicenter was only 25 kilometers away. And we see, when we look at those Google maps, we definitely see little clusters of damage and whatnot, absolutely reflecting soil conditions. Soft soil, much more damage. Harder rock, much less damage. These are engineering issues that not only are not being addressed, but right now there are no tools to address them. And so I think that that's where we're starting from, and hopefully my colleagues here will point us in the right direction of how to maybe alleviate some of these paradigms. Louise.
Hi, I'm Louise Comfort, Director of the Center for Disaster Management at GISPIA, Graduate School of Public and International Affairs. And my interest is this, a longtime hazards researcher, but my major interest is in the decision-making process, the kind of issues that my colleague Kent has just raised, and the basic question is, what should the government do? And what we've seen is in any risk situation, there are basically 4 steps to this decision-making process. The first, cognition. You have to recognize the risk. You have to understand what it means to have no building code in a country that is on the Caribbean, is located in a geologically seismic region. The second is communication. If you know what the risk is, you have to be able to communicate. And that means establishing not only a technical infrastructure for communication, but a pattern of organizational interaction and processes and a culture of sharing information that is critical. If you have the first 2, then you can create what we don't have in Haiti, which is coordination, multiple organizations interacting in order to accomplish a common objective. When that happens, then it's possible to have control, but a different kind of control. This kind of control is self-control, where the organizations themselves are observing a set of standards. The engineers are building buildings according to code. The organizations understand what those risks are. Now, I want to turn to Dean Burke's question. So what can a university do? Universities, honestly, are very unique communities and can bring a great deal of resources and influence on processes like this. Universities can create epistemic communities. That is, a community of knowledgeable people from different perspectives. This is what our panel represents. And focus it on a common goal. In this case, helping Haiti recover, rebuilding Haiti. But there's something special about epistemic communities, and that is they're geared towards action. So it really is pulling together a group of people with different skills, different knowledge, different degrees of expertise around a common goal, and looking at it not just from the standpoint of understanding what happened, but also how do we translate this new idea, these goals, into action. And I would say that I think Haiti represents, in many ways, an opportunity for the international community to bring together a set of ideas that have been articulated in the United Nations Office of Coordination for Humanitarian Assistance for at least the last 20, 30 years. And that is the United Nations does have a cluster format where it asks governments, NGOs, organizations to coordinate their efforts. One of the things that has not made this possible, the idea is there, lots of people recognize it, it hasn't had the communications infrastructure to enable this to happen. Right now, in 2010, we now have the technical infrastructure to do this. So my response to Dean Burke's question is one of the things that the University of Pittsburgh can do, I think, is to pull together an epistemic community focused on this particular goal and be able to identify workable strategies for action in each of these areas: engineering, public health, management, agencies, etc. And with that, I'll turn it to my colleague, Sam Stebbins.
Hi, I'm Sam Stebbins. I'm at the School of Public Health. I'm the director of the Center for Public Health Preparedness. I'll try to keep this brief because there's lots of other interesting folks to follow. My approach is sort of thinking about public health systems, and I think it's fair to say that we do not know how Haiti is going to recover at this point. Okay, just comparing it to other disasters, other earthquakes, I don't know if there's one of similar magnitude, where a country which was already quite so impoverished, a country of essentially one large city has had that city devastated in this way. So I think it's important that we go into this feeling relatively sober about, we don't actually know. I do not know how it will recover. I mean, long term. Let's be realistic about that. So I do know two things about public health. One is that systems matter. To the extent that there's, a clinic, or a group of volunteers, or a well that's providing clean water, those are all good things, but they are not a substitute for thinking systematically about a clean water system, sewage systems, electrical systems, systems that actually will help sustain a population, over time. And I noticed that in the early reports back from Haiti. I was thinking about this, as the military flies in 300,000 meals ready to eat. And that's a lot. That's a lot of meals. I don't know how much that weighs, but I mean, that's a huge undertaking. I mean, that was going to be one meal for maybe a third of the displaced population for one day. I mean, so this is where systems are really important. Food distribution systems, agriculture systems, all these different things are going to be incredibly important. When thinking about the public health system, I have to put in just a brief plug for the definition of public health, which is collective activities to create and perpetuate the conditions in which people can be healthy. And the key thing here is collective actions. And one of the things that I think we'll hear more about is sort of, what can and should the people of Haiti be doing? And this is a really key sort of thing, because at the end of the day, this is stating the obvious, the international groups will largely go away. And the people who live there currently will be, the ones most directly affected by what's going on. And so I think it's going to be incredibly important that this opportunity is not missed to provide education, training and all sorts of things for the folks who live in Haiti to the greatest extent possible. And I don't mean rebuilding the elementary schools. I mean actually working with the adults who are currently there now. Because the infrastructure that's missing is not just the roads and the bridges and the electrical systems, but it's also, as Kent kind of implied, it's also engineers and lawyers and public health physicians and, you name it. I mean, all folks who are needed to sort of recreate an existing society. And then just one last thing, which I think is probably the most important. It's not really public health, but when you look at a public health system, in my experience, there's two things that make it stronger or weaker. One is war. All right, so the absence of war is a very good thing for a public health system. The presence of war is a very bad thing. So sort of safety and violence are key issues. And the second is the economy. If you have a place that does not have economic infrastructure, the public health system will not be sustained and it will not endure. In a place that has an active economy, they may still make choices that lead you to sort of a weaker public health system, but at least it's possible. So I don't think I can state strongly enough that without some kind of serious economic restitution, for Haiti over the next 5 to 10 to 15 to 20 years, our activities will not be sustained, and this is a very important thing. Thank you.
Afternoon. My name's Dr. Stephen Williams. I'm a physician, assistant professor at Drexel, and my experience of Haiti is primarily in the healthcare sector. I've been working there on and off for 20 years. I've lived there for several years. It's interesting to hear what the other people are talking about. And I'm not going to speak specifically about health right now. The problem in Haiti is Haiti has a government that does not function for the benefit of its people. Haiti, for 200 years, has been pretty much the best definition you could find of a kleptocracy, where an elite group of families controls the island, controls the wealth, and leaves the impoverished population to fend for themselves any way they can. They have outsourced all of the things that a government should do for their population. They do not provide schooling. They do not provide health. They do not provide health care. They do not provide sanitation. They do not provide building codes. They don't provide infrastructure. They barely provide electricity, and only to places where the elite are. So the government doesn't work for the majority of the population, whether in Port-au-Prince or outside. It exists for the benefit of the elite. And they have managed to survive for 200 years. Now, whether this devastating earthquake will change the situation and focus enough attention on Haiti that these elite will not be able to usurp all of the aid and maintain their position of power and privilege, I don't know. But I have my doubts, because I think the world will turn away and aid will flow in and these people will resume their positions of power, and that will spell the doom of Haiti for the future. Because no matter what we do, if you do not change the way the government functions in Haiti and the way it interacts with its impoverished population, you will not fix the problem. And Haiti will continue to be poor. It will continue to not have building codes that are followed. It will continue to not have infrastructure. That country shares the same island with the Dominican Republic. How many people here have been to the Dominican Republic on vacation? Anybody? It's beautiful. Okay, it's a third world country. It's poor. I'm not going to say it's a shining model of wonderment, but it's on the same island as Haiti. Haiti is the poorest country in the Western Hemisphere. It used to be the richest colony in the New World. Something happened in 200 years, or something didn't happen. And what didn't happen was government.
Hi, I'm Mary Carrasco. I'm a pediatrician and director of international and community health at Pittsburgh Mercy Health System. First, a disclaimer. My interest in providing any services in international health has been in working with system change. Now I'm going to tell you about my involvement in Haiti in particular. I was in the middle of a very busy period. A colleague came to me and said, you have a call from Mary Buechel, who's someone I've worked with very effectively on child health issues, and she wants to know if you will examine 2 kids who they're sending a corporate jet to pick up, who have adoptive homes in Pittsburgh, and they won't have health care available when they come back. Would you be willing to provide physicals for the 2 kids? And I said, sure, they're sending a jet, I'll go pick them up. And an hour later they said, oh, you're going to pick them up? Or there are 30 kids. Could you do that? And I said, sure, if I can be back by Monday. This was Thursday. And I'm heading off to a meeting. So we were at the meeting, and I was wondering about the health status of these 30 kids. Would they be sick? Would they have diarrhea? Did I need to worry about IVs? Did I need to worry about more intensive things than I personally could do with 2 kids? And within 10 minutes, I had 3 volunteers willing to come with me. The meeting lasted 3 hours, and within that period of time, I was now picking up 150 kids. So we needed a few more volunteers, and we had heard these kids were pretty sick. So there was a lot that went on between then and the time we came back with 53 kids that I won't get into. I think the key lessons I learned were that coordination is essential. There are hundreds and thousands of people who really want to volunteer. This particular event seems to have triggered a depth of response that I haven't usually seen. It really has impacted people. We have nothing to do with adoption. Within a day, we had at least 50 people calling us wanting Haiti orphans. We don't do that. We have nothing to do with that. But there is an inordinate need for coordination, and we were talking earlier, and you said that's a function usually provided by government, and the government is absent in this case. I think both as a community here and somebody needs to do that for Haiti. I think Global Links was very helpful to us in providing a level of coordination for the medical system. There's a need for coordination across systems too. So I'll turn it over.
I'm Kathleen Howard. I'm the Executive Director and co-founder of Global Links. And of course, like everyone else, we've been watching this whole disaster, first when it happened, but the continuing disaster unfold with the problems of getting aid to the people, with appropriate aid coming in, with problems of, everybody wanting to do something, and sometimes not a measured response by people. And what we have been trying to do is coordinate some of those efforts in the city with UPMC and equipment donations and supply donations with the Hospital Albert Schweitzer, and we are really planning for longer-term involvement in Haiti. One of the things I think the university community here and the institution itself is to provide more kind of teaching to the public about what is appropriate response. Because I can't tell you how many calls we've had about people that say, well, I saw in the news that people don't have water, so our school has collected bottles of water, can you send them? And that's not just from here. We've been getting calls around the country for that. And actually right now, even a dear friend of mine said, our school wants to collect bottles of water. I think we could collect 1,000 of them. We asked the Red Cross, and they said they just want money. Can you do this? No, because the appropriate response is, no, we need your financial support. Drink the water, send us money. And, it comes from wonderful intentions, but there needs to be more education. And I would say that there needs to be something, I think, even to people that are writing the newspaper articles about this, because we're not immune to looking at these terrible situations and what, the feelings that they invoke in all of us. I mean, everybody wants to go down and pull people out of the rubble. I mean, that's just a human response. But what needs to be addressed is that that's not the appropriate response. And you can do more harm than good by providing materials that aren't immediately useful. It's not the right thing, not the right time, and starting collections. And we have set back here some information from the Pan American Health Organization, their information about what is appropriate response. And that really needs to go out to the public more and more. Doing collections of things that aren't really requested, that you don't know how things are going to get there, and it's really a waste of time and resources. And I think the most important thing is the long-term effort that's going to be needed in Haiti. The public has, face it, a short attention span. So what the university committee can do also is to keep Haiti fresh in people's minds and what we're doing there in a coordinated effort. Thank you.
Hi, I'm Cathy Biko, and I lead the Philanthropy Forum at the Graduate School of Public and International Affairs. And I also consult with families and individuals on their philanthropy. And my task today is to begin to talk a bit about philanthropy's role, not only in Haiti and in disasters, but going forward. And if you think about philanthropy as the mobilization of private voluntary resources for public good, the numbers about Haiti have been somewhat astonishing. And I'll just take a second to paint the numbers because they elicit, I think, trends that will help us think about what the implications of Haiti are and how we sustain focus on Haiti going forward. As of January 29th, over $560 million have been raised, according to the Chronicle of Philanthropy, and they're keeping an almost daily tally, and they're polling 40 organizations. And this money outpaces the rate at which money has flowed to any other natural disaster in at least our experience to date. And the monies are flowing to faith-based as well as secular organizations and international relief, even presidentially led initiatives. The money is coming in amounts of, if you calculate the number of donors and the organizations that receive them, in gifts of $100 or less, indicating that lots of individuals are giving. Celebrities have played a part. That has been a consistent line in past disasters as well. But I think we are seeing the power finally taking off of online and new technologies, which have been heavily at work in mobilizing philanthropy on both the institutional and the individual level, because as many of you know, most of the philanthropy that flows to the nonprofit sector comes from individuals rather than from institutions. So just one number that is staggering, the Red Cross has garnered about a third of this money, $198 million, $30 million of that generated by a text messaging system. Now, this has implications about how we engage individuals who care about disaster and those in need, how we can try to convert that attention and the impulse to connect to longer-term sustained engagement with the issues. And that engagement can take many levels. It can be public policy advocacy to ensure that governments stay situated and focused on the long-term needs of a country like Haiti. It can be in mapping the continuum of needs that so many of these panelists have eloquently talked about, so that individual foundations who want to have a mission-related focus to their giving in Haiti can find an opportunity to give to environmental reconstruction, to children's issues, to civil society. They can find a way to play a part and still be true to their institutional missions. But if we map this continuum and continue to share it with the public, using these new technologies and appropriate messaging, we may finally be able to provide the on-ramp to convert this goodwill into long-term engagement with these issues. And so I am hopeful that an institution like the University of Pittsburgh, with the expertise of Louise and many others, can take this opportunity to help us create this architecture of collaboration and coordination on the funding level, and provide individuals with the on-ramp they may be seeking. Kiva and other online Network for Good, for example, other online giving systems have proven that individuals want to connect to a local cause. They want to see the face of where they can give. We also know from past investigations of how philanthropy has or hasn't worked well in response to disasters, that you're better and more appropriately off if you're donating to local organizations or those with on-the-ground expertise. Technology and information in this instance helped individuals through their social networks and through other media find those local connections and those indigenous partners. We have several of them in Pittsburgh. In November, I was in Haiti to look at Hôpital Albert Schweitzer. Their needs will continue to help in the reconstruction. So we have Global Links working profoundly on the longer-term health needs of Haiti, and we have Brothers Brother, and we have other organizations in our own locale who are doing this. I think the university has many options here to help the public see what constitutes a good philanthropic investment, and to help the public find the on-ramp through data and through an architecture of collaboration. And I'll leave my comments there because there's more to say about the government piece as well. Thank you.
We'll now open the floor for questions and comments from the audience. I'll take the speaker's prerogative and do the first one. And back to Dr. Teixeira again. You mentioned some ways that organizations can be helpful by partnering with local organizations. One of the problems we're going to have is how do we focus our activities? It's been said here that we have expertise, that we've got a will, that I think we've got a common vision, but how do we focus that? And so you had some suggestions you started to talk about, but I'd like to hear you expand on that a bit if you could.
I'd like also to say that, okay, in this moment, the emergency is there, so we have to feed people, we have to to give medicine, to treat people. And so any help, any aid will be very helpful. And PAHO will be organizing these offers. But I'd like also to tell you that we have to think Haiti and try to help them to think themselves in a medium and long term. I don't know how many of you knows that Haiti is one of the richest country in the world in terms of painting. They have the most wonderful naive paintings in the world. All Haitian is an artist. They make sculptures, painting, they dance, they make music, poem. I was talking before that there is a city in front of Port-au-Prince that is known by the city of philosophers. The entire city is philosophers. So there is another Haiti that nobody knows, or just a few people know. And how we can work with this other Haiti in order to promote sustainable development. Because what health means, health is not just the absence of illness. Health also means happiness, means income, employment. So if we can think differently and say, okay, what we can do with those artists that are living there in order to promote income. If you organize some exhibition on Haitian painting, it is a success all over the world. And then you can generate income to thousands of people that live painting. There is many people in Haiti living by the arts. So it is another way of thinking development in Haiti, not only the conventional one. I'm very convinced that the vocation of Haiti is tourism and arts. But in order to promote tourism, we have to promote security. Security means income, employment, not just employment, income. So they have hundreds, thousands of handcrafters and people working so if those people have income, they can have health. They can access to health services, and they can be proud of themselves, because they don't like only to receive things, to receive aid. They are rich people in terms of cultural lives, no? So I'd say in order to cooperate, we have something that they need. They need food, they need medicine, they need water supply. And the situation can be worse from now, when the rainy season starts 2 months from now. Then, because Port-au-Prince has a channel, all the city has a canal, drainage canal. This is completely destroyed. It was also before, because there is no public cleansing services. So all the canals has been used to dumping wastes. But now it's worse, because all the bulky wastes from the destruction is everywhere. So when the rainy season becomes, so we can be prepared for those diseases related to waterborne disease, such as dengue, malaria. Port-au-Prince is the last, I think the last capital in the hemisphere that has urban malaria. So they are facing many problems today, but tomorrow they will be facing different and even worse situation.
Thank you. All right, any comments, questions from the audience? Please.
Question for Dr. Williams, question for Dr. Williams or anyone else who would care to comment. I think you're right on in terms of your remarks about the responsibility of the Haitian government. And the U.S. role is going to be critical there. So given what the U.S.'s relationship has been with the elites of the country in recent years, what do you think that the prospects are that the U.S. is going to support efforts to redistribute power?
Unfortunately, I really don't feel qualified to give any kind of educated answer on that. We've had a long and not very illustrious history with Haiti. When it was first independent, it was a successful slave rebellion off the coast of a slaveholding country, and we refused to have any relationships with Haiti. And then we invaded in 1919 and occupied it until 1930. And we have periodically stuck our fingers into their political system and to help manipulate it to our benefit over the years. As long as Duvalier was against communism, he was good enough for us. Same with his son. And we were very happy with Cedras, who incidentally is, my understanding is correct, is a graduate of the School of the Americas, also known as the School of the Assassins to some people, from Fort Benning, Georgia. He was our man too, until the heat got too much and we put Aristide back in, until the heat got too much there and we got rid of Aristide. So I don't know what our ongoing relationship will be with the government. I know that it's tarnished in the eyes of the Haitians. However, at this point, the Haitians would be more than happy to become the 51st state in general, because they figure that way at least they'll get something.
If I may respond, I think there are some conditions that are optimistic about this situation. And the first is that disaster in other situations in other countries tends to shatter the existing structures of organizational and political power. Right now, the elite has no infrastructure and no ability to do that. The second thing is that the international spotlight is now on Haiti. And much of what Professor Williams has described indeed occurred behind the curtain. And one of the very important things that this disaster can do, because it has been so devastating, is to bring the international spotlight on Haiti, keep it on Haiti, and keep it on the participating organizations that are there. We only need to look at the significant change that occurred in Mexico in 1985 after the Mexican earthquake, and 350 journalists came in with cameras and reported it around the world. The second major shift was in Indonesia after the 2004 tsunami, when finally the international community brokered the peace agreement, and the GAM and the Indonesian government have now resolved their differences and so on. So I am very optimistic, but at the same time, it's going to take two things that are really critical. One, a very transparent approach to managing this aid, which I am also pleased to say the United Nations has a program, a cluster program for doing this. Dr. Terciero mentioned the health sector, but the United States is following the cluster format in Haiti for the first time that I have seen it in 25 years of disaster management. This means that the U.S. government is very much aware of its role. It's got the technical capacity to do this. It cannot afford to lose the confidence of Latin America. It does have Latin leaders in Venezuela, Nicaragua, Peru, Cuba that are watching, and the U.S. government has clearly made a decision to try to follow the UN rules. And that's probably my basic reason for optimism in this situation.
Thank you. Other comment, please.
This question is directed to Dr. Harris. You mentioned a lot about building codes. I experienced Hurricane Hugo. I'm from the Eastern Caribbean, and one of the things tend to be an overemphasis on the particular hazard. In my case, the hurricane-resistant structures for building codes. What do you foresee going forward as a balance between reconstruction that relies heavily on earthquake-driven codes, and how do you build in all hazards during this reconstruction period?
That's an excellent question. There are not a lot of multi-hazard regions when we talk about hurricane and seismic. Interestingly, the United States has one, Charleston, South Carolina. And in just in a little bit of history, I used to work in South Carolina, and I wrote the multi-hazard commentary for the residential code. So I know a little bit about what you're talking about. In terms of the balance, that's going to be difficult to strike. Balancing multi-hazard is not that difficult from a technical perspective, but getting it adopted into code bodies is. Even in North America, we still don't really do that properly right now. But one of the things that we're also going to be struggling with is, according to some of my colleagues I've been talking to in leading up to this, we're already rebuilding. Masons are already out there doing exactly what they did before. Even if you tomorrow changed the government and said, oh, there's a building code, you're going to all follow it, that's not going to work. Even if we did bring it in, it's 20, 30 years down the line until it really evolves into an infrastructure that is more or less compliant. Hopefully, and I think that you do raise a good point, we have overemphasized hurricane hazard in that entire region over seismic, partially because I think one of the things I mentioned earlier is that there's not a lot of memory of seismicity. As I said, a comparable event was about 240 years ago. We looked at Charleston, South Carolina. The last great event was 1886, so none of us really remember that, and yet it was the largest East Coast event ever. We are going to have to strike that balance. The technical issues are there, but I'm honestly not certain that's the first thing we have to address. We've got to get something in place that's a little bit more formalized to develop an infrastructure that's a little bit more sustainable and a little bit more resilient in the first place.
Next, front row.
This is more of an observation. I don't know who can address this, but when I read about Haiti, I'm struck by the fact that there are 9 million people in an area the size of Maryland, with a per capita income of like $1,300 a year. So, and it's an island that's been deforested with few natural resources. This strikes me as a really tough problem to solve, since they need to be able to come up with economic solutions for themselves. So I guess my question is twofold. One is, thinking of models in Africa, when you help women with family planning, the standard of living goes up. And I know the culture, that's not part of the current culture, but how do you work on that? How do you help with population issues and women's standard of living? Are there efforts to that effect? And the second is how to find some industries or economy or something that they can do to build up their country. I mean, art is a start, but it's not enough.
Someone like to take the issue of...
I'll just speak a little bit to, like any other country, if women do not have rights to control their own bodies, then you have the same kind of problems in any country that you see across the spectrum. There's lots of babies, women who can't control, don't have say over their own sexuality, that it's a male hierarchical culture. You have these kind of problems. So I think concentrating on women's issues, women's health, women's effort, and birth control, women in Haiti want to have those options. I think that's going to be absolutely critical moving forward. And now with this pool of money that is being collected, those kinds of infrastructure or programs are going to be absolutely essential to change the dynamic that's there now. I think it's critical.
Thank you. Right? In the blue? Yeah.
Realistically speaking, after events, especially these proportions, slum developments are going to grow. People lost their houses, they lost their jobs, they can't afford to live anywhere else. And already Haiti, I think, has at least 1/3 of it, or Port-au-Prince has 1/3 of its population living in slums. In slums, their communities are extremely underserved when it comes to health care. How is that problem going to be resolved to keep from people moving and then disease spreading because they don't have proper conditions?
Hi, Sam Stebbins here. I don't know what the exact answer will be. I do know that it's probably going to be useful to think about Haiti recovery in terms of stages. I'm not an expert on this, but I would love to see someone really sort of lay it out where stage 1 is, it's subsistence economy, and stage 2 is whatever, stage 3, and so on, so that there's at least for me, there's a clear sense of what needs to happen. On issues around health and public health, again, it's trying to get systems in place is very important. You'll see measles outbreaks, occurring, very soon, once the vaccination rate, gets below a certain point, which it probably already is. Existing problems like HIV and AIDS and tuberculosis are already fairly severe problems for the island, and need to be addressed as well. So, if I were in charge, and one of the key things is going to be sort of things that affect populations to the extent possible. So infectious diseases, things that cause outbreaks, to the extent that you can, clean food and water. I worry also about environmental contamination in the water as well, especially with the rainy season coming up. So again, something that's not going to be an infectious disease, but it's going to make people ill, and particularly those who are most vulnerable, usually in those situations. So you really need to think about water testing, clean water, ready access to those. Beyond that, there's also going to be all the people who have hypertension, and heart disease and cancer, and I don't think there's any systematic way to get to those folks, off the top. I think that has to come in a later stage. I do think there'll be a lot of spot activities around that from some of the existing hospitals. They'll be able to, do a little bit here and there, but in terms of kind of a system-wide approach, for me, that would come a little bit later.
I think also part of the problem is that so much attention is always being paid to the area around Port-au-Prince because it is the most heavily populated area. But paying all that attention to Port-au-Prince over the years has brought more and more people to live in that area because the rural areas don't have services, don't have, the same educational opportunities. And I think now that people are moving out towards the rural areas now because they're afraid, partly, and to get other services, that a lot of attention has to go out to those rural areas to give people, a reason to stay there. I mean, this happens all across developing countries. People think they have more opportunity in larger cities, and that's how the slums develop all around the cities. And unless you can control that migration by providing opportunities, healthcare in the rural areas, that's going to be extremely important. I think, part of the reason why we're seeing such a catastrophe is because there were so many people in such a small area.
Yeah. One of the things that I'd like to observe, I also spent 3 years running a hospital in Africa as a Peace Corps volunteer. And so I have experience in 2 developing countries. As we rebuild the health system in Haiti, one of the things you see in the developing world is that the central hospitals tend to suck up a large portion of the health budget of the country with more sexy services like surgery and the sort of intensive services that help a few people with a lot of money. And public health takes a back seat often, where $1 goes a lot farther in an immunization campaign than it does providing one 350th of a cesarean section or something. But it is hard to turn away that mother who's about to die on your doorstep and say, well, we're not going to do the cesarean section so we can immunize 350 babies. And that's a balance that they're going to have to try and find as they rebuild hospitals in Port-au-Prince and decide how much money the government wants to allocate to building these big health centers and leave to the rest leave the rest of the country to its own devices.
Were you talking about the U.S.? or-
Right, well, the last comment. Yeah, go ahead. Good. Sam?
Just one last thing as well. I'm not an expert on this either, but this issue of what's called micronutrients is also very important, especially post-disaster. Again, because a lot of the food that may get rushed in may be just very sort of carbohydrate specific, and there's actually a lot you can do with very small amounts of micronutrients. Certain key vitamins and minerals, especially if you're having your 700 new babies, and their moms every single day. These are all folks who are going to become nutritionally deprived or who are at risk for it quite quickly. And this is actually quite a solvable problem with a fairly easy, relatively cost-effective intervention that I'm hoping is already going on.
David?
We've heard the figure that at least $500 million has been collected. I saw in the New York Times, I think about a third of it was to the Red Cross, and others are fighting amongst themselves to get their piece of it. I'm sure that before we're done, there's going to be hundreds of millions and billions more dollars directed to Haiti. And I guess my question is, first of all, who right now is in a position to allocate that money in according to any vision or coordinated plan? And what steps can we look forward to seeing the voice of the Haitian people? Dr. Williams is very skeptical that their voice is ever going to be heard, and he may be right about that. But what steps ought the international community, donors such as we, be either taking or encouraging to have authorities in place, legitimate authorities, to be making the allocation decisions, choosing between where to build a hospital, how much to account for birth control for the women versus clean water, and so forth. Traditionally, of course, we like to think that sovereign governments do this kind of thing for their people, but we're in a state now of such a vacuum of local authority. It seems to me the risk is very high that we'll put the country into some kind of receivership, and that decision-making will be taking place by those who have the biggest pot of money to spend right now.
Next week, let me
Please.
take...
If I may respond to that, there is already in place an organizational format for collecting, assessing the needs, allocating those resources. This is the United Nations cluster format. It has not operated particularly well in any other disaster except the Asian tsunami. And it was a situation that was relatively similar. 30 years of a civil war, the Indonesian government, newly elected president, but in Aceh, the respondent was the Indonesian military, right? So the Acehnese, the people of Aceh, would not go to the disaster field centers or the rescue centers because they were staffed by the military. The president honestly understood that and said, okay, we've got people who are dying, we've got to do something, we're calling in the United Nations. At that point, there were strong leaders in the United Nations. One of them was Jan Egeland, and he said, we'll do it under one condition. What's that? That you give us, you Indonesian government, give us, the United Nations organizations, the authority to establish and run these relief activities, shelter welfare activities. And we're going to do it by the rules. And so clear format, clear set of rules, and anyone who participated had to register as a United Nations organization and register what their skills were, what their staff was, what they're bringing in, and they had an information center that drove the decision-making process. Now, it wasn't perfect, but it made a huge difference in the management of the aid.
Is that structure happening now? Are places like Red Cross, Partners in Health, people who've collected huge amounts of money now, have they acknowledged the United Nations as the authority that should now be organizing how that money is going to be
Haiti was different. First of all, the United Nations mission in Haiti itself collapsed, and 71 UN staff were killed, and about 170, were injured. So in the first couple of days, they weren't able to function. Now, the UN has since replaced them. There were already organizations within it, but one of the key steps is the one that I mentioned before. The United States, which was given the responsibility, the lead responsibility for the response by the President of Haiti, has agreed to follow this UN cluster format. So I am hopeful. It isn't perfect, it isn't working as well now, but by setting the lead example, by negotiating and communicating with the other organizations, a little bit of sniping from Europe at first, but now they are communicating. There was a major conference in Montreal last week where the donor nations all got together and agreed to follow the UN format. We'll see if it happens, but it needs to be followed, documented, and analyzed.
Let me jump in also. Louise, could you, just for my sake, explain what the cluster format means? It's a little jargonistic, and so I don't know exactly what it means.
I'm sorry. It's a very simple idea. Basically, the United Nations Office of Coordination for Humanitarian Assistance has identified key functions that need to be performed in any disaster: food, shelter, water, logistics, communications, health, and PAHO is the lead, running the lead cluster in the health organization, which I think is excellent. And, surely they know this, organization. The other factor is that NGOs that come in then need to register with each of their clusters and assign themselves to a cluster, saying our basic skills are in providing meals or vaccinations or whatever. Then there is a series of meetings where they meet. Each cluster meets every day, certainly in the response phase, and each cluster has a cluster lead, and they're supposed to communicate within the clusters. And that is happening. There are now 13 clusters operating in Haiti, and I'm not certain that all organizations have registered under it, but increasingly organizations have.
Excuse me again, I'm sorry, but Cathy was next, and you'll be after that.
Just a quick comment. The Red Cross, who now commands about a third of the money that's been collected in the United States, announced this week a meeting of coordination about a forthcoming plan and involving the UN and Red Crescents and Red Crosses from other countries, taking a lead from the Haitian Red Cross and involving the World Bank and other agencies. I guess the thing to look for now is alignment with the cluster protocol that Louise has talked about. I was on a call last week with a number of funders and the Office of Special Partnerships from the UN, in addition to the office you mentioned, participated. They are looking for coordination with private philanthropy as well. That's another node to watch and a place where advocacy that insists on the registration process, the integrity and transparency of that, along with a continuing focus on civil society organizations in Haiti itself. That's a whole nother subject that has to be advocated for and funded.
Thank you. Follow.
And there is as Louise was talking, the OSHA is the United Nations organization that organizes these clusters, the different clusters. We have a procedure. We use a flash appeal. We call the flash appeal. It's a project. We elaborate projects for each cluster, and we call it flash appeal. And the money comes very quick, very, very quick to implement different projects and different clusters. This money doesn't go to the government. This is money administered by United Nations itself. But usually both systems exist. The governments giving money to United Nations and then that are organized by clusters, and the clusters decide with the government and the others what should be done. And so they elaborate the flash appeal projects, and the money comes very quick for the reconstruction, whatever. But the other way is the NGO. Any NGO that wants to be there, they are there, and nobody can say no. So this is this is a problem also, because the capacity of the country to receive all those people is limited now.
How do you leave an infrastructure in place after you leave without permanently bankrupting this country in perpetuity?
You want to explain why this process will add to bankruptcy? And
I mean, you have to have a sustained investment in the country for some period to leave an infrastructure in place, because you pull out aid and you talk about risk and volatility. They have it's a very volatile place. It's a very risky place, and the extreme of that is that it falls back into collapse after the money leaves. There has to be a sustained infrastructure that takes the place after a conversion. To make those infrastructure investments, there has to be some international aid, and it was part of that UN cluster. There's an assumption that there would be a financing arm to this, that there would be an infrastructure investment arm to this, and how do you put that in place without permanently putting them over the barrel for a long period of time, is my point.
If I may respond to that, the UN cluster format does expect that there is a graduated process of turning over the infrastructure to the local government. It does, however, mean there needs to be a training program that accompanies the construction, rebuilding organizations, etc. In Haiti, this is, often it's like 3 years, maybe 5 years. In Haiti, it's going to be 10 years or maybe 20 years, because we're dealing with a population that is 62% illiterate. This is one of the critical, issues, is bringing, and where Sam Stebbins' point about phases, I think, is very important. It's, in a sense, nation building. I hate to use that term because it has a military connotation to it, but in fact, it's really rebuilding or enabling a society to manage its own risk. It's going to take time, it's going to take training, but it has to be an infrastructure that is turned over to the local society, the local people, when they are able to manage it. That is in the UN format. We just have to implement it.
Thanks. We have a few minutes left, and in that time, what I'd like to do is to make sure we have a little bit of discussion about what we should be doing as a university community. So if people have strong feelings about what we should be doing, and this is not next week or over the next 2 weeks, but as for the next year or 2 or 5 or 10, any suggestions here? How do people feel about that? Yeah, please. Is that Jenny over there? Okay.
Haiti's assets of the wonderful art, and we're fortunate in Pittsburgh here because we have Friends of Haas, and you can go to their website and see how to get that art. But in addition, they have sun, they are an island, and do we have solar and other sustainability things that we could bring to the people or teach as far as agriculture and growing? When I was down in Haiti, I was told that at one time there was a lot of chicken farmers, and then when the U.S. started mass producing chicken and started flooding Port-au-Prince with chicken, they lost their livelihood. But is there a way to re-empower the women of Haiti in these rural areas for growing crops and plants to feed themselves, and maybe we can then buy those crops to feed as opposed to just giving them stuff?
Well, actually, HAS has a program to reintroduce different native species of trees to Haiti, and in the process to help farmers move from subsistence crops to more higher valued crops. And this is viewed as a public health initiative. So it speaks to this idea of seeing health much more holistically and imagining health initiatives that have economic and agricultural activity attached to them. It's exactly that sort of approach that I think are necessary if you're trying to reestablish the economy and the health of this society.
Well, I also think that an important point of that was the U.S. flooded the market with cheap chicken. And if our policies don't change, these poor countries can't fight against that. So we have to be looking inward at how our policies here also affect the development or the destruction of local communities and their livelihoods.
Without making it sound too trite, so we should, I'm not sure where this takes us, is that should we have a policy, sort of the cheap chicken policy? Is that, you know what I'm saying? I'm trying to make it in a phrase, should we have, or should we aim our activities more toward U.S. policies and economics toward Haiti? Is that what we should do, instead of worrying about partnering with institutions? Did I just hear you say that?
No.
Right.
I think if the university wants to get involved, they have to find a partner in Haiti. Like something like the Schweitzer Hospital or the University of Haiti, which will eventually reestablish itself. And I think, university to university or university to institution. The Schweitzer Hospital is actually an entire health system. It involves wells and water, reforestation, agricultural education, and it serves the entire needs of the Artibonite, that portion of the Artibonite Valley. Unfortunately, because of the global economy, prior to the earthquake, they've been under severe financial constraints, and they've been cutting back on their services. So, if the university wants to be involved in things like that, there's wonderful opportunities from, half the departments that this university has to partner with an institution like HAS and become involved with students, professors, but also financial resources. You can't just send students down there to have a little, vacation, working vacation to get some experience and not provide resources.
Okay. Yeah. I want to get some of the audience ideas. Yeah, please.
I actually agree with what you said about the cheap chicken. I think we should focus on changing our trade policies and changing our farm subsidies, because until we do, they can't make money themselves, and they'll always be dependent on us. So.
Okay. Right. So, Maggie.
I think Dr. Williams started with a really good idea, Don, and I think this whole enterprise has brought a new level of partnership within our own community. So I would like to see the university work really hard to sustain and develop that so that we can indeed partner with an on-the-ground organization in Haiti and work over the long term toward the rebuilding.
Right, please. Yes, right here.
This is different from what's been mentioned, but there are a lot of broken families in Haiti right now because you have kids who probably don't even know their genealogy. I think one of the things that this university could actually work on is reestablish genealogies, working with orphanage, those type of things to really reestablish family structures that's been broken because everybody has been lost except probably a toddler.
Sorry. Do you have any? How would we do that? Do you have any idea about how to go about that?
I don't know, because really that's not my focus, but just from a personal standpoint, when you lose a family, if you lose all your family, I know the university have departments there that deal with study of genealogies and so all those things. Connecting with universities and organizations there will probably enhance that and help to rebuild some of the family structure, put people back with, families that they don't even know, but with their own families at least.
Okay, good. Please.
one idea we could do that would involve the students as well as the faculty might be having like a university-wide book club where we all read the same book or are invited to read the same book and host meetings where we can discuss the book all about Haiti, maybe for 1 year, each month a different book.
Okay, so some way of focusing attention, to bring the community together without a specific activity, but just consciousness raising. Okay, yeah, there was a, please, Doctor, over here, behind you.
The young man that just spoke is Aaron. He just came back from Haiti, and he was there during the earthquake and survived and got out of the country. So I think it's a great idea to educate ourselves, which is where we need to start, because I heard a lot about the history of Haiti here today, and many of us don't know that history and don't know why they are the poorest country in the Western Hemisphere. So I think that's a great idea to start there. One of the panelists talked about forming some collaborations with HAS, which I think is a great idea. Prior to the earthquake, Global Links helped me establish a relationship with HAS. We actually had an MOU with them where we would send residents and students down to HAS to work. And it was our hope that we would actually build a collaboration with them, connect with one of the institutions, the universities there, and to really establish a program where we can then go into a lot of research that would help the Haitian people. However, that was a very, very difficult thing to do. Maybe this is the time where their doors are going to be open so we can do that. They did not at that time want students. They only wanted physicians and we hear many people have been there. They don't want students there. They want faculty or upper-level residents who are with faculty. They do not want to mentor. They did not want to mentor our faculty members or students there. They want you to come and speak Creole. And that's a disadvantage because many of us do not speak Creole. So I think maybe this is the time where the doors are going to be opened wider for us to really reach in, become partners, and make a difference on the healthcare scene. Because I can see clinical expertise both on collaborations on both sides. So I think that's where we need to start, educating ourselves and then staying focused on the healthcare of the Haitian people. Because, healthier Haitians means that we have workers who can then build their own country. Their whole idea of trying to have all Haitian physicians, nursing staff in their hospital, they are very proud people. And that was their goal, to make sure that all of their healthcare workers were Haitian. And I think that's where they want to get back to. But we can help them do that.
Thank you very much. Margaret, please.
If I might just respond to that, having been on the faculty at HAS, we do accept students, but only with a preceptor. The hospital, at one clinic day, I saw 85 patients myself. There's no time to teach when you're seeing 85 patients in a 12-hour day. So we would accept a faculty member bringing a student as long as that student could be precepted by that faculty member, but to just send students down to take up our time while we're desperately trying to get through the clinic, that's what they would not accept.
Thank you. Right here, please. No, over here. Right here.
Hi. I went to the University of Washington, and there we had a professor who specialized in Guatemala, and she taught a course and then took a bunch of people down to Guatemala, and they formed like a fair trade, sustainable, coffee, working with the farmers and stuff, and they brought it back to Seattle, and they were able to sell the coffee in Washington State and then send the proceeds back to the farmers. And it'd be interesting to see if there could be something like, I'm from Gispia, and if you were to do disaster management, do it all year round, and then maybe see what you can do in the summer and bring people to Haiti and possibly make that like a potential internship. And that way we would have skills to take down there instead of just showing up and having no idea or having to be mentored.
Yeah. As was pointed out, one of the problems is that the language requirements are different, the cultural demands are somewhat different, even so, and it has been harder than in many other locations because of the expectations. So we need to meet those, basically. Yeah, please.
Hi, I have a comment regarding the University of Pittsburgh's role. I'm a medical student here. And I think that if you look at what a university does, it is educate students and be a source of sort of institutional knowledge and permanent education of people coming through the system. And what I think the university's role could definitely be is implementing an institutional type of change that includes Haiti in its educational systems. For example, when I was looking to learn Creole before going to Haiti in November, I noticed there's no courses on Creole in the University of Pittsburgh. I was a Latin American Studies major, not here, but I looked into this program when I was looking for the Creole, and Haiti's never included in any sort of Latin American Studies curriculum or focus, even when you discuss liberation theology and military regimes. So I think if you're talking about institutional permanent awareness, as soon as you begin to recognize the need for language programs that include Haiti, Latin American Studies programs that include a non-Latin, I guess a French country in the system of educating students that are interested in that region, you change the institutional awareness and you change it more permanently, and you create a new group of people who become experts in that region. And so if the university is really interested in Haiti, then what shows real interest is real allocation of university education and resources. And if the university is unwilling to permanently institute resources and systems of education into their actual university as opposed to extra efforts, but into their actual systematic education, then it's not going to become a permanent consciousness of students who come through the University of Pittsburgh.
Great idea. All right. David, you've spoken. Okay, you get to go again. All right.
It's along the same lines that Laura's suggesting in terms of our educational resources. We obviously have technical skills in public administration, public health, human rights, law. Do we have an opportunity for training some of the Haitian people? We do fellowships and internships here, and with the idea that it would build capacity there. I don't know what the current enrollments have been of people from Haiti in any of our professional schools, but I'd be interested if there are ways of streamlining that, or maybe using this as an occasion to focus some efforts that way.
If I may respond to that, I am a faculty member at GISPIA, and a great idea. We did have an international management development program where we did have groups from Haiti and trained them in international management. Regrettably, that program was funded by USAID and was cut at a time of, financial downsizing, I'll say.
When was that? When was it in existence?
This had to be like 15 years ago. Class actually in the early 90s, 94, there were trips back and forth. I indeed included Haiti as a model in a course that I taught in policy analysis. So there has been interest in Haiti at the university. I do think that the point about teaching the language is critical, because this was one of the difficulties. We did have faculty members who spoke French, but the difference between French and Creole is significant. If we're training young Haitians for leadership positions, then we need to develop a capacity in Creole, which the university does not now have, and I think that's an excellent suggestion. Internships with Creole-speaking students, I think it'd be great.
I'd like to comment for just a second, and I'm going to get myself in trouble here. We're focusing an awful lot on Haiti, and this is wonderful, but there are many other regions that would benefit from this discussion. The Horn of Africa is a seismic zone. Is that going to be the next disaster? I do a lot of work in northern India when we have another Kashmiri quake from a couple of years ago. Are we going to be back in here and saying, oh, we've got to get more Indian students? If we want to talk about what the university needs to address and be reactive, this knee-jerk, and I don't mean to offend anybody here, but focusing too much on one thing is a little bit knee-jerk. Haiti is this year's flavor, and maybe because I'm an engineer I get to say things like that, and it doesn't sound too nice. But what's next year's flavor? And so if we're going to react as a university, I would argue we've got to be a little bit broader. Certainly having opportunities to learn Creole would benefit and have a big thing, but is that necessarily the answer it might be the answer in this week's flavor.
Well, one thing the university might consider, to your point, is to inventory the expertise that it has through an assembled team.
Yep.
And to have criteria that could be developed about what the university can offer in particular circumstances when they arise. So there's a coordinating effort across the institution that can mobilize resources and the kind of expertise that might be necessary, and Pitt can speak with one very masterful voice in that effort.
When I did introduce the session, I said we had two objectives. One of them was to say, what can we do in Haiti over the near term in helping in that restoration? And the other one was this point that you bring up, is that how can we structure ourselves so that we can be more helpful more broadly across as other disasters come up. We really haven't spent any time on that, but that's an important area that we at the Center for Global Health will, I think, try to convene groups around that question about how can we be better prepared the next time around, to whether it's helping public opinion or our awareness of the things that can or should be done, whether or not it's finding experts who can be helpful in the short term, whether or not it's providing consultations or direct assistance. There may be a number of things that we can do in a more organized way than we did this time around. So I think that's another discussion that we will have in the future, I'm afraid. We're already a bit past time. With that, no, I'm sorry, we're going to have to, I appreciate you want to say that. I will say thank you. We've had the participation, the thoughtful questions were extremely helpful. I can guarantee you we will take these back. This group will meet again. The Center for Global Health will meet again. We'll try to do something constructive that will address both the objectives, and this has been very helpful in that process. So thank you for participating.